Still can't let it go.
Well, I was just going...
This lady just won't give up, will she?
I was just...
You've got to admire her tenacity.
Oh, once Mrs. Denby sets her mind to something.
Oh, we need people to take the little things seriously. If only to remind us what really matters.
The suggestion box did matter.
So much so you locked yourself out of it.
Yes, well, we did manage to get it open.
By dropping it from a great height.
Sometimes you gotta do what you gotta do.
There is a sense of the ridiculous in that solution.
It's for Mum. If we can get some vitamin C inside her, then she gives herself a fighting chance.
That's a good plan.
No, honestly. She's dead set. I really think she means it this time.
I have seen it with some patients. It's like something finally gets through and they know what they need to do. Good luck.
Thanks.
This disease-sniffing dog seems like a good idea. I've seen them on the telly. They can tell from someone's pee if they're poorly. All you have to do is like, line the pee up and they sniff it. You just show that one to Anthony.
Look, some of us are trying to work here. Excuse me.
Everything okay?
No, not really.
You want to talk about it?
I'm perfectly fine.
Clearly you're not.
Hey, you would not understand.
Try me.
I'm being ridiculous. There is nothing to tell.
Oh, those robots have stopped being funny. I would have been on time today.
You're only a couple of minutes late.
And my son, he wants to see a doctor.
Okay, well, let's have a look at you. I can look after him from here.
Oh, no. I'm coming in, too.
Sure? Okay. Okay, now, can you tell me exactly where the pain is?
It's just a tummy bug. I'm sure there's nothing you can do.
You never know, so... Well, I can't feel any swelling. Have you eaten anything unusual?
Well, of course he hasn't.
My eyes keep going blurry. I'm feeling really faint and thirsty all the time.
You don't appear to have a fever. I can take a urine sample, get a couple of general tests done.
No. As I said, it's probably nothing serious.
We can't know that for sure. Look, you can always take him to A&E and let them check him out if you're not happy with me.
Absolutely not, no. They'll just pump him full of chemicals. It's far better to let the body take its own natural course. Expel whatever's upsetting him.
Look, we need to be sure that there isn't something more serious going on here.
What do you mean, serious?
Now you're just alarming the poor boy.
No, I mean, we need to check that there aren't any possible underlying causes. That's...
I'd rather just go home. The pain's not so bad now.
Give me a ring if things don't improve over the next 24 hours, okay?
Can't remember asking for a cup of tea.
I thought you needed one.
Oh, thank you. That man looks very familiar. Do you know who it is?
No, is it?
Well, if I knew that, I would not be asking you.
Maybe she's waiting for someone.
Don't you think I have considered that?
Oh. Maybe he's taking a fancy.
But who?
You.
But don't be so ridiculous.
Oh, he's only got eyes for you.
Come sit down, Mum. Film's about to start. Slightly scarlet. I think I've seen it before.
Remember all those old films we used to watch together?
One I should have been at school, you mean?
Fun, though, eh?
getting worse.
Can you get yourself back to the surgery?
I can't get out of bed. It hurts too much.
I think you really need to phone an ambulance, mate.
But you said to call you. Oh.
Where's your mum, Zethan?
I don't know. Please help me.
Zethan? Hello?
Hello.
I need to head off and see that young lad from earlier.
She's already got to you.
She?
The mother.
What about her?
She's going to put a spell on you. She is a white witch.
Thought white witches were supposed to be good.
Not when they've got Munchausen's.
Oh, she's a hospital hopper.
Not confirmed, only suspected by me. She's been on my radar for a while. You know, there was always something. All these symptoms, they got worse and worse.
But there was nothing wrong with her.
I think the husband left and she didn't cope very well.
All I saw was a pushy mother.
You see, you say that, and yet, you know what, it's an hour since they were here, and yet you were already off chasing her calls.
Actually, it was the son who phoned, and well, he did seem in a pretty bad way, actually, so...
If I find a toad in your consulting room later, then I'm going to know what's happened to you.
Funny.
I'm not going to kiss you back to life.
Can I help you?
I very much hope so.
Well, you will need to come over to the reception desk.
To be perfectly frank, I wanted to catch you on your own.
Me?
I wondered if you were free for lunch today. Maybe this would explain better. Please consider it. Trust me, I am a bearer of good news.
The icon bar at 2:15?
I'll be there.
So who is he? Come on, tell me.
Oh, it was nothing.
Is it me, or does Dorothy have a drink in her hand all the time?
Looks like it.
Wrong time.
Bad girl, Dorothy. Knocks it back all the time. St. June tries to save her.
I don't remember any of this.
You sure? You're not just trying to make a point, are you?
Mom.
It's never about the good guy struggling with the booze, is it?
It is sometimes.
Never about what sets them off in the first place drinking.
If I didn't earn money, who'd get you out of trouble? And who'd pay off those lovely friends of yours you seem to attract the way garbage does fly?
See? No one gives a damn what Dorothy's going through.
Oh, right, well, what's the house?
Oh, baby, let's see. Oh, she's so grown up. Oh.
She's doing well.
It should be me. Took her into bed and reading the stories, not Tracy. I bet she wouldn't even remember me now.
Of course she would.
It's all down to you.
Mom.
It's all your fault. You messed up my life with your meddling. It's too late to sort myself out now.
Think about the future.
What future?
Don't give in the minute you get a low.
I need a drink.
No, you don't.
I do.
What about a nice cup of tea, eh?
Stick the heating on, will you? It's freezing in here.
Who's the dude in the poster?
My dad.
That's handy. Having a superhero for a dad.
He most definitely is not that.
He doesn't live with us anymore. I don't get to see him.
You really should have discussed it with me before calling the doctor.
It's getting worse, Mum.
Well, this is the best thing. He's getting rid of whatever that bug is.
He needs to go to hospital. I'm concerned he's becoming more dehydrated.
No, I can get fluids into him.
Please, Mum.
I'm phoning an ambulance. And I'm not leaving until I know he's on his way.
doggy. I reckon I got food poisoning.
It's not that. Aching muscles, nausea, feeling nervy, it's all part of the process of getting you well again. So I was thinking, maybe we should pamper you a bit to make it easier.
Oh, tighten my nails, I'm going to sort this.
But a massage might help.
Oh, please, Ish. A little shot of something, and then I'll be okay.
You'll start to feel better in a few days.
I'm a wreck. Look at me, love. I've never looked this rough. We're doing it wrong. I need a drink to keep me alive.
Come on, Mum. Let's start with your hands, okay? That's it.
Jeff Goddard, practice manager, King's Green. But this still does not explain why you have brought me out to lunch.
Because, Mrs. Tembe, you are being headhunted. We have been trying to recruit an assistant practice manager, but we couldn't find anyone suitable. And from everything I've heard, you are the ideal candidate.
What do you mean? Why would you think that?
Well, Anthony Harker tipped us off, gave you glowing references.
He did what? I am sorry. I had no idea. I am not looking.
I'm sorry, that's a misunderstanding. Sorry, Mrs. Tembe. Please, at least hear me out, Mrs. Tembe, please.
I'll get you, my pretty.
Yeah, not funny, Al.
All right, sorry. How's the boy?
I can't figure out what's going on, so I sent him to hospital. Is it all right if I go over there?
Yeah, of course. Why would I care?
The mum did seem dead set against it, though.
Oh, so we're not talking Munchausen by proxy, then?
Oh, no, she definitely didn't want him going to St. Phil's. In fact, she was convinced that they'd harm him and that she could cure him naturally.
With what? With eye of toad and ear of badger?
Yeah. In fact, I can't say I'd fancy any of that weird stuff that she was mixing up.
Or maybe she's concerned.
The hospital will find out what she's been up to.
Yeah.
It's for your own good, love.
It's gross.
Come on. We need to get you better.
How are you doing, son?
Okay.
Now, does that hurt? When did you first notice the pain?
Can't remember.
What about the sickness? Well, don't worry. We'll soon get you sorted out.
What medication do you intend giving him?
Well, first, we'll run the usual blood and urine tests to see if we can locate the source of the problem.
Well, are all these tests really necessary?
Of course. We don't do them for the fun of it. Okay.
Well, I have heard that your practice is very patient-focused.
Which I happen to know fits in very well with your own ethos.
Well, I suppose Mr. Harker told you that too.
Not just Anthony, I spoke with Emma Reed.
Really?
I know her from PCT days. She spoke very highly of you. Apparently you're a bit of a catch.
Oh, well, I'm not sure about that. It is very flattering, of course. You know, I visited your practice once. When I was acting practice manager at the Mill Health Centre.
Mm-hmm.
Oh, it had a lovely atmosphere and up-to-the-minute facilities. I noticed that your doctors, well, they are in charge of their patient notes, which I think is very important for continuity of care.
And we worked very hard to achieve that. You're very observant, Mrs. Tempe. Look, I'll be honest with you. I'm in a bit of a hole. I've been working without an assistant for a couple of months now, and despite a rigorous ad campaign, the caliber of the applicants has been...
Right, I see.
And here you are, and you're perfect.
Mr. Goddard...
It's an excellent opportunity. There's plenty of scope for you to shape the role as you want.
It sounds very tempting.
I don't want to be pushy, but it's very frustrating when I know how good you would be in this job. And it's a great step for you career-wise. I know you're interested. Well, you have been in the past.
Yes, well, that is true.
So, I am offering you the job, here and now. What do you say?
You were not feeling any better then?
No.
Have you noticed anything you've been eating tasting different lately?
What do you mean?
Bitter, maybe?
No.
Anything you've been drinking?
No.
Is your mum a good cook? I mean, mine wasn't bad, but...
She's okay. Why?
Well, I just remember that my mum's food sometimes tasted a bit... odd.
She can be a bit...
That's it. There you go. Just let it all out. I'll get someone to get rid of this.
See Mrs. Tempe?
Well, is Mr. Harker in his office?
Yeah.
I have been offered a job.
By Jeff Goddard. Oh, that's great news.
Of course it is. It is exactly what you wanted.
I'm sorry?
You recommended me for a job I did not apply for. You gave me a glowing reference that I did not ask for.
Praise given where praise was due. You're being paranoid, Mrs. Tempe. I simply saw an opportunity to progress your career. It's what you wanted, isn't it?
At the Mill Health Centre, for a while, yes. And then you were appointed. And I was resolved that it was not meant to be, and I was happy with my lot.
You have so much to offer at King's Green.
I have so much to offer here. I have always given 100%.
No, I agree, but you're clearly wasted at reception. Don't let one knockback destroy your ambition.
I am perfectly happy here.
Are you? Honestly? This is about your potential, Mrs. Tempe. Maybe the leap to practice manager was too much, but assistant. Surely that's ideal. You learn the ropes without so much pressure, and it's a stepping stone to practice manager in the future.
Everything is happening so quickly. It is a huge step.
King's Green's the other side of Leatherbridge, not the country. So you have a longer walk to work, or you buy yourself a car. You can certainly afford it. Seize the moment, Mrs. Tempe.
I have no idea what to say to you.
Obviously, the choice is yours, but I think a new challenge would be good for you.
I have taken the job.
Glad to hear it. Congratulations.
Sid, will you trust us to look after your patients?
Oh, no. Something was just bothering me, that's all. Wisteria.
I'm sorry?
I found this pod under Zephin's bed. Wisteria seed. They're poisonous.
Well, yes, I'm sure they are.
What do you think of Zephin's mum?
Why?
I just wonder whether she has anything to do with Zephin's sickness.
What makes you say that?
I'm just a bit concerned for her, that's all. Her husband walked out, she's bringing up a teenager on her own, and... well, she's been to see us quite a few times, actually. It's a suspected Munchausen. Yeah, she really didn't want Zephin to come here.
I see. Or it could, of course, just be a simple case of white coat syndrome.
Yeah, maybe. We should talk to her. Look.
Let's just wait until we get the results back, shall we, before we start making accusations? Not to say that we can't keep a discreet eye on things.
Do you not have any other patients?
I'm just concerned, okay? For both of you.
I'm fine.
Yeah, well, you know, must be hard, coping on your own.
Well, it hasn't been a bed of roses. I've had to take on a part-time job just to make ends meet. But his father took to the hills. So we manage as best we can. What have you got there?
Why? Do you recognise it?
Well, of course. I use them in poultices. What are you doing with them?
You do know they're poisonous.
Yes. What are you suggesting?
Snap!
Was it?
Try and concentrate, it'll help.
Help who?
You.
Oh, this is really boring. Why is it so hot in here?
You said you were cold.
It's boiling. What are you trying to do? Kill me?
You can't keep taking this out on me. It's not fair.
I'm trying, love. It's just so hard. I didn't mean to take it out on you.
It's okay. We'll get there.
Oh, I'm starving. How about I make us something to eat, but no more fruit? Deal?
Deal.
You want some water? Do you want to come? Make sure I don't add anything?
I'm just trying to work out what's wrong, that's all.
Or conduct a witch hunt. This is why I didn't want to come here. Why I don't trust doctors anymore.
I want to help both of you. It may be
That I'm so deranged that I'd want to harm my own child. All I've ever given him is sage tea to help with the nausea. Does that count as poisoning? Or maybe it's the spell I cast in it. No doubt you're in on this too.
I told you I wanted to wait until we got the results back.
And?
Well, they're not conclusive, but the white cell count is up, which could indicate a poison.
So what now? The ducking stool?
Is it possible that your son's symptoms could be related to the ingestion of wisteria pods?
You can't just accuse me like this.
Leave her alone. She hasn't done anything. It was me.
We'll keep him in overnight to monitor him, just while the poison works his way out of his system.
How long will that take?
Oh, usually no more than about 24 hours. Look, I'll call in again later just to check how things are going. Okay?
I'm so sorry, Mum. I didn't mean for any of this to happen. Honest, I didn't.
I just don't understand.
I looked up the symptoms and they seemed okay. I thought if I got sick, maybe I'd get to see Dad again. I wanted to tell you earlier, I did, but I got scared I would get into trouble. I didn't mean for Mum to get the blame.
That was me jumping to conclusions. I'm sorry.
Why didn't you just talk to me?
Mum's right, you should have talked to her.
You know, for the first time today, the doctor's actually said something that makes sense.
Colin. Look after yourself, mate.
Why didn't you tell me what was going on inside your head?
You hate Dad.
But I love you. I feel terrible. You know, I've been trying to deal with this on my own, but I didn't realise the effect it was having on you.
Maybe we could cast a spell and I could see him again.
I can't change your dad. There's not enough magic in the world for that one, love.
Get some sleep, Mum. Before you know it, we'll have cracked the first 24 hours. You did really well today.
I have been offered the position of assistant practice manager at King's Green Medical Centre.
And you're happy to just watch her go?
Of course not. I can't imagine the place without you.
Will you make me the happiest man alive? Marry me.
Say again?